was about 5 years ago we decided to investigate the various robotic systems that were available. And at the time we wanted to replace the old emergency drugs cupboard that we had in the pharmacy. That was a problem because we had people trying to access that all the time and they wouldn't fill in the list of what they'd taken. So every couple of days we were having to stock take the cabinet to see what it was that they'd taken out. Otherwise things were running out. So we put an Omnicell in, we investigated how well it worked, we were very impressed with it. And from there we went on to the stage where we're at now, and we've got about 56 cells in about 13 locations. The Omnicell stood out as being a very easy to implement solution. The thing for me that really made the difference was the BioID, using the fingerprints to log in. It made it so much easier.
Previously, before we implemented the Omnicell, we used to have a drug cupboard. Biggest frustrations to our department and our clinical area was that we didn't have the accessibility to the right medication for our patients, so that we couldn't give them an impact on the patient care and the care delivery. The introduction of the Omnicell has introduced safe mechanisms. It assisted us in the safe, timely discharge of our patients by allowing us to have all discharge medications that we can accessible for nurses to dispense from the area, which then assists with patient flow and assists with patient safety.
Prior to Omnicell, the stock was stored in 2 central locations. We had to obviously carry 4 lots of keys. You know, the staff were constantly shouting for keys and constantly staff leaving patients and things like that for unnecessary amounts of time to go and access that. The stock currently is stored within these, I think, 9 Omnicells, and you know it's managed in a central location which is in the centre of the ward. In terms of you know, the end user, the patient at the end of the day, you know, the medication is available. It's much more accessible in a timely manner. We're not having to worry about out of stock items because they're replenished automatically. We're not having to worry about items that may have gone out of date because of the rotation of stock is much safer. We are not leaving the patient for long periods of time.
Prior to getting the Omnicell in place in A&E, we were using a cupboard with keys, which was a nightmare. Trying to get the keys from everybody took a lot of time. People bringing the keys to you wanted, people going home with the keys in the pockets. Now we've got the medicines managed on the Omnicell, which is a lot easier and safer. We can go straight to what we want because the machine tells us where it is, and we're not rummaging in the cupboard like we had before to try and take a medicine out that may look similar to another one, and maybe some people that will take out the wrong one. It's definitely helped to save in nursing time because we're not looking about for keys, we're not looking about for people who's got the keys. We can go straight to the machine, and that saves us time and gives us more chance to work and give patient care.
What we do is we have an expiry date report generated for stock that's going out 6 to 3 months in advance. And what we do with that is, as the cycle count teams go out, they remove the stock and they move it around the hospital so it actually gets used. So we aim to have very little stock expiring. Also, very few stock outs now, so the stock is available for the patients, and therefore fewer missed doses, and therefore the patients actually recover quicker.
Now we've got visibility of the stock across the whole of the trust in the 13 locations that we're using it. So we've now got the ability to manage stock, to optimise stock, which we never had before. As a pharmacy manager, whose prime interest is patient safety, is to make sure that we've got the right amount of stock. So it's not having too little, too much, it's the right amount, and that when the nurses need a product, they can find it and they're guided to it. And I'm sure the Omnicells give us the ability to manage the system for having the right stock in the right place. In terms of patient safety and missed doses, I think it's fairly simple that if you can see where the medicine is and you're guided to it, and you've got visibility of what medicines are available, then you're likely to have less missed doses. We've noticed that on the wards with the Omnicells, we've got a reduced rate of reporting of medicines errors. The nurses are not having to do the ordering. They've got time to spend on patient care. That's bound to be a positive thing for patient safety.